Hello, everyone. It's a great pleasure to welcome you to join the International Sepsis Lecture. This free of charge event will now happen monthly and will be the opportunity for anyone around the world to attend outstanding lectures about sepsis. And it's a great pleasure for me today to have uh, as a guest Professor Jean-Marc Cavaillon, who's from the Pasteur Institute in France, who spent most of his professional career working on sepsis pathomechanism, trying to understand how an infection can result in deregulating the inflammatory response and driving organ dysfunction and eventually death in children and adults. So it's a great honor for me to have Jean-Marc Cavaillon explaining us about the story of sepsis over time. So without, and before giving Jean-Marc the microphone, I would like just to highlight that you are attending that conference from about 37 countries around the world. So I think it's a very great opportunity for people like Jean-Marc Cavaillon to provide take-home messages around the world on that important topic. So Jean-Marc, once again, thank you very much for the time you are giving to us, and we are listening to you now.
Thank you, Djillali. Well, first of all, I would like to thank you for inviting me for this first set of conferences, and we'll address a bit of history of sepsis. But before that, I would like to thank you for your confidence through the years. In fact, we are just celebrating the 20th anniversary of the paper. You invited me to join you to write about septic shock, and it happened that it's indeed my most cited paper. At that time, 20 years ago, you sent in the laboratory your internist, Virginie Maxime, and she did a terrific job on studying the macrophage migration inhibitory factor in sepsis patients. We also wrote together a paper about a topic that I think is important to the consideration of sepsis, which is compartmentalization. And one of our last review was about the question to boost or not to boost. That is the question about what to do in immunotherapy of sepsis patients. And I think we were right, because in fact, in 2023, two papers were stopped, two studies published in 2023 were stopped because of side effects of those immunoboosting. Okay, so now it's time to move directly to the past and to address first Lucrezia Borgia. Just for those who don't know her too much, just remind you that she was born in 1480 and died young at the age of 39. She was the natural daughter of Cardinal Rodrigo Borgia, the future Pope Alexander VI. And she had three husbands, and she gave birth to 9 children. And she belongs to this long list of famous people who died of sepsis. They were musicians, painters, scientists, kings, singer, actors, sportives. And so just to mention one nobody knows, but we also died of sepsis, is Miss Agnès Souret. She was 26 years old when she died of sepsis. And in fact, Miss Agnès Souret was our first Miss France in 1920, and she died while touring in Argentina. So regarding Lucrezia Borgia, She died of puerperal fever. And I will come back on this topic as soon as possible. But first, before, among the famous people, I would like to mention Lord Carnarvon. As you know, he's the one who discovered the tomb of Tutankhamun. And when he died, it was called the curse of Tutankhamun. And since we are back in the Egyptian time, I just mentioned that on the left, you have an ancient Egyptian child mummy in which the presence of E. coli was indicative of bacteremia and which likely contributed to death from sepsis. And more recently, there were this paper which studied 21 child mummies with purulent infection, suggesting that they most likely died of septicemia. Back to puerperal fever, it was unfortunately rather common. And for example, in 1880, the former director of Institut Pasteur, Émile Duclos, he was the one who succeeded Louis Pasteur, and he married Mathilde Briot in 1873, had 3 boys. And unfortunately, she died when she gave birth to the 3rd boy of puerperal fever. Now, in the Latin period of when the doctors were writing in Latin, you could find the concept of puerperarum febribus, for example, by Thomas Willis, who was an English physician, pioneer in neurology and anatomy. He was a co-founder of the Royal Society. And in his book and on topic addressing fever, it proposed that terms. A few years later, in France, still writing in Latin, the concept of puerperarum morbis was proposed by François Morisseau, a French surgeon, and also an obstetrician. And finally, the word puerperal fever was coined in 1718 by Edward Strother. In his essays on different types of fever. In fact, Strother loved to create new words. And this is another word he created. I leave you here. I will not read it, but it was the qualification of the water of the spa city of Bath. And in fact, it's the longest word in English. And finally, septicemia was coined by Pierre Piori, a physician in Paris. And he coined it from the Greek sepsis, meaning putrefaction, and hema, of blood. The first thing which clearly appeared was that, in fact, puerperal fever were contagious. And indeed, in 1646, was recorded the first epidemic of puerperal fever, which occurred at the Hôtel Dieu Hospital in Paris. In 1751 in New York, John Burton, a physician who wrote this essay on midwifery, suggested that puerperal fever could be a contagious disease. But probably the one who made the major statement was Alexander Gordon. Alexander Gordon was an obstetrician living in Aberdeen in Scotland. And in Scotland, in Aberdeen, there was this epidemic of puerperal fever and wrote this treatise about these events. And Alexander Gordon said in his book, this disease says such women only when they were visited or delivered by a practitioner or taken care by a nurse who had previously attended patients affected with the disease. It is a disagreeable declaration for me to mention that myself was the means of carrying the infection to a great number of women. Quite amazing a statement for a doctor. And about hygiene, he said, nurses and physicians who have attended patients with puerperal fever ought carefully to wash themselves and to get their apparel properly fumigated. On the following century, Thomas Ingleby, still in UK, in Birmingham, wrote this article in which he said, everything leads me to believe that the effluvia from the body of a woman who died of puerperal fever were transported in this way by 2 practitioners and quickly produced the same disease into other women. Still in UK, in Doncaster, Robert Storrs made another observation. He said in his paper, I had opened an abscess or dressed the wounds of cases of erysipelas, and if I made every effort to avoid the transmission of the contagion from one case of puerperal fever to another, not being aware of the danger of this particular case, I probably carried the contagious agent to each of them. In the States, Oliver Holmes, who was a well-known doctor, you see him there reading his essay in front of the members of the Boston Society of Medical Improvement, working in Harvard, and he published this paper on the contagiousness of puerperal fever, suggesting that indeed it was transmitted by the contaminated hands of medical personnel. And he also proposed hygiene, but unfortunately, his recommendation had very little effect on the practice of his colleagues in the States. And why that? Well, because he was in Boston, but at that time, the main city for medical research and medical doctors, the most famous one was Philadelphia. And in Philadelphia, there was Charles Megg. And Charles Megg wrote this book about childbirth fevers, and he said the following. Talking about a physician of Philadelphia, he said, he's a gentleman who is scrupulously careful of his personal appearance, of great experience as a practitioner, and well informed as to modern opinion on the contagion of childbirth fever. Still, those of you who are contagionists will say that he carried the poison from house to house. And if so, then you ought to give some rationale of the fact. Did he carry it on his hands? But gentlemen's hands are clean. But as you have seen, some of those doctors were clearly proposing hygiene as a solution. And indeed, we have to pay tribute to Ignaz Semmelweis, who observed the problem, which was puerperal fever, who developed a concept that there was a link between the hands of the medical students after autopsies of cadavers, and he carried out prophylaxis, which was the use of calcium hypochlorite. In fact, he was not fighting bacteria because at that time, bacteria were not known. He was fighting the odor of putrefaction that were carried by the hands of the medical students after autopsies. So he solved a clinical problem, reduced mortality. Do you think that he became a member of academia, received awards? Not at all. In fact, all his life, he fought against the medical nomenclatura. Of course, nowadays he's well known, especially in Hungary. But just a few words about his life. He was born in Buda, and this is his house where he's born. His parents were owner of a grocery store. And at the University of Pest, he obtained a degree in law. He then enrolled at the Second Vienna Medical School, and his thesis focused on the life of plants and their therapeutic properties. In 1847, he was already approaching 40 when he married the young Maria Weidenhofer, barely 20 years old. They married, defying the wishes of the Weidenhofer family, who nicknamed Semmelweis Crazy Ignaz. After overcoming the consecutive deaths of their two first children, Ignaz and Maria lived happily surrounded by their three daughters. So in 1847, Ignaz Semmelweis was working at General Hospital in Vienna. And in this hospital, there were two clinics, two maternities. And in one, the first one, it was the students, medical students, who were taking care of the pregnant woman, whereas in the second clinic, it was the midwives. And the mortality in the two clinics were clearly different. An event occurred in the hospital in the death of Professor Jacob Kolečka. Jacob Kolečka died after wounding himself with a lancet during an autopsy of cadavers. And he died with the same clinical symptoms as the woman who dying of puerperal fever. And then that helped Semmelweis to understand the link between the medical students who were attending autopsies and then who were helping the woman to deliver babies. So he was very successful by antiseptic method, proposing calcium hypochlorite and reducing the mortality due to peripheral septicemia from 16% to less than 1%. After the end of his contract, the contract was not renewed and he had to leave Vienna. It took time to publish his observation. It took 11 years before publishing in an Hungarian journals, and finally in 1861 he published a book in German about the etiology of childbirth. So it's not him who really contributed to the dissemination of the discovery, but rather his students or his young colleagues. And indeed, in 1847, already just after he made the observation, Ferdinand von Hebera made this communication in Vienna about the observation of Semmelweis. The following year, Charles Ruth in London published communication of the endemic puerperal fever of Vienna. So some doctors came across this observation, and one of them, it was in Germany, Gustav Adolf Michaelis. He was one of the very first obstetricians to successfully apply Semmelweis method. But he was so desperate to realize that he had contributed to the death of his patients that he killed himself. Surprisingly, some very famous people like Rudolf Virchow were against the idea of Semmelweis. Still in 1848 in France, the communication was made in front of the Academy of Science saying Mr. Semmelweis, head of clinical of the Vienna General Hospital, sends a note on puerperal fever on a cause which he regards as very frequently presiding over the development of this disease. The following years, the Gazette Médicale de Strasbourg also published this observation in Vienna. The following years, again in Vienna, Joseph Skoda also republished this observation. And finally, in 1851, Franz Hector Hermes went to Edinburgh and in front of the Medical Surgery Society, and in Paris, in front of the Academy of Medicine, made a communication about the demonstration made by Semmelweis. So as I said, finally, in 1861, Semmelweis published his work, and is in a book which was sent around Europe. And for example, in the archives, General Archives of Medicine, headed by Eugène Follin and Charles Lassègue, they published a note about this book. And they said, our formal opinion, supported by a sad experience of illness, is far from being favorable to the exclusive theory, which is not suggested, but affirmed by Dr. Semmelweis. The defense of his doctrines has the air of pamphlets of the Middle Age, when Latin excused the most violent apostrophe. So Semmelweis, after leaving Vienna, went back to Budapest and worked in the obstetric department of St. Roch Hospital and applied his approach, and the mortality because of puerperal fever was less than 1%. On July 31st, 1865, en route from Budapest to the spa town of Grafenberg with his wife, Semmelweis was committed to an insane asylum during his stay in Vienna. And he died there, this is the place, on August 13th, 1865. An autopsy was performed by Karel Rokitansky in the same Vienna General Hospital. And what we can read is the following. Semmelweis, 47, died as a result of mistreatment during his internment. This abuse caused sepsis with numerous superficial and deep infection sites, like gangrene in the middle finger of his right hand, hyopneumothorax, and metastatic infection site in the left kidney. So finally, after his death, he was buried on August 15th in the Schmelz Cemetery near Vienna. Few people attended his funeral. Even his wife was absent, and only a friend from Budapest made the trip. However, his greatest enemy, Karl Braun, who succeeded him in Vienna, did attend the funeral. Finally, in 1891, he was transferred in Walter family crypt, which was the mother of Ignaz Semmelweis' wife, at the Kerepesi Cemetery in Budapest. In 1894, he was transferred to a specific tomb made in his honor at the Kerepesi Cemetery, which is the Hungarian National Pantheon. And finally, in 1964, he went with his last new tomb, which is placed in the country yard of his birthplace. Of course, nowadays he's famous in contrast to during his life, and statues have been built, raised. This is the one which is just in front of the hospital in Budapest where he has been working. And the University of Budapest changed his name to the University of Semmelweis. And again, there is this statue of Semmelweis on the campus of the university. And I was quite surprised to see that he has also a statue in some place such as the Tehran University Medical School. And in fact, he is the only Occidental famous person having his statue over there. And I was lucky enough to be invited at the University of Szeged in Hungary to inaugurate it on 2018, so for the 200th anniversary of his birth, the statue of Semmelweis. The work and the life of Semmelweis has been the topic of the thesis of the young doctor. So it's a medical thesis by Louis Destouches. And maybe some of you know that Louis Destouches was finally well known as a writer. And this is in his book, The Portrait of Semmelweis by his wife. Two movies have been made, one in 1951, made in East Germany about Semmelweis, and the second one in 2001 in the States. And this movie received quite a large number of awards. Okay, let's come back to sepsis and puerperal fever, and we are back to the maternal clinic at the Vienna General Hospital. And 15 years after Semmelweis, Professor Karl Braun, who succeeded Semmelweis, was now the head of the maternity at the Vienna General Hospital, and he asked his assistant, Karl Mayhofer, to demonstrate that finally airborne organisms were the source of puerperal fever. And what Karl Mayhofer did in two papers published in 1863. But finally, in 1865, after his initial work, Mayhofer reached the same conclusion as Semmelweis, believing that it was indeed contaminated ants that were the source of infection and not the atmosphere. Not surprisingly, because of the relationship between Braun and Semmelweis, Mayhofer didn't mention in his paper the work of Semmelweis, and he was invited to leave the clinic in 1870. Now, I'd like also to pay tribute to another key person in terms of hygiene, as Florence Nightingale. Florence Nightingale was attending the Crimean War, and she was working in the Scutari Barracks Hospital in Turkey, and she introduced the sanitation methods, including hand washing, and reduced infection and mortality rates in her work. Back in London, in 1867, there was a severe epidemic of puerperal fever over there, and she introduced and listed all the risk factors that were needed to perform hygienes to prevent this puerperal epidemic. And she was awarded the Royal Red Cross by Queen Victoria, and you can see her statue here at the Waterloo Place in London. Now let's move from the putrid infection to sepsis. In other words, not only women who were dying of sepsis, but also men. I'd like to mention Richard I of England, known in France as Richard Cœur de Lion. He was wounded by an arrow of a crossbow during the siege of Castle of Chalus-Chabrol, and he was only 41 years old. That was happening on March 26th, and the wound was not lethal, but finally he died on April 6th. He died of infection and of sepsis. And indeed, all those soldiers who were fighting on the battlefields were finally dying, not always from their wounds, but also from putrid fever, hospital gangrene, and hospital fever, because later on they were admitted in hospital where they were dying because of those reasons. And it's what we call the nosocomial infection. In fact, nosocomial infection, or nosocomial, is a Latin word, nosocomial meaning from the hospital. And at the time when the doctors were writing their papers in our books in Latin, they were using the word nosocomial for fever, from typhus, from gangrene, wherever they were coming from, Austria, from Hungary, or from Germany. And once they started to publish in their own language, I mean, in German, in French, or in English, the word nosocomial was maintained. Now, nosocomial and putrid fever, hospital gangrene, hospital fever, was shown to be contagious. That was demonstrated in 1810 by Alexander François Olivier, who was a physician and surgeon in the Napoleon Spanish campaign. So he injected himself with pus from the wound of a severely wounded soldier who was about to die of putrid fever and demonstrated that it was contagious. In fact, he has to use cauterization to stop the infection that he has introduced in his body. It took a time to publish his observation in only 1822, so 12 years later. And again, the medical nomenclature denied the originality of his observation, and people like Pierre-François Percy said it was a well-known event. Alexandre François Olivier also listed all the behaviors necessary to prevent contagion. Now, we have to realize that puerperal fever and hospital fever might be the same. And the first one to think about was James Simpson, a Scottish pediatrician in Edinburgh in 1850. He argued that puerperal fever and hospital fever were of the same nature and that both were highly contagious. He said that the spread of infection could be reduced if all medical personnel washed their hands with chlorine before each examination. He believed that both puerperal fever and surgical fever were caused by the spread of a poison in the blood of one patient to another. And finally, Simpson advocated for methods such as hand and instrument cleaning to prevent sepsis. 8 years later in France, Armand Trousseau came to the same conclusion. He said, strange as such a confession may seem, I do not believe it is in its existence. I mean that puerperal fever is not specific to women and that it also exists in men. Puerperal fever is contracted like cholera, like yellow fever, or intermittent fever, and there is no evidence that a pre-existent general condition is necessary for it to develop. And he finally concluded, I firmly believe in the contagion of surgical and puerperal fever. Now came the time to identify the nature of this infection and finally the identification of the germs. But at the beginning, people were thinking it was an inflammation. For example, in 1746, Antoine de Jussieu, who was a French botanist but also a physician, observed that puerperal fever in Paris, which he considered to be an inflammation of the uterus. He also proposed, among other approaches, experimented the effects of certain plants against fever, such as quassia bark. Still in France, Jean Astruc, a physician and obstetrician, published an influential treatise on the disease of women and presented puerperal fever as an essential inflammatory condition caused by suppression of the lochia following delivery he added that the disease can become putrid through a simple process of suppuration. Similarly, in UK, in the Middlesex Hospital, Thomas Denman, who wrote the first book entirely devoted to puerperal fever, also considered inflammation. He described women dying within 24 hours and said, some authors believe it is an inflammation of the uterus, while others have confidently claimed that it is limited to the intestine and that the uterus is not involved. Still in the UK, and with John Leake, who was a male midwife, the founder of the Westminster Lying in Hospital in London, he observed that puerperal fever began as an inflammation of the abdominal viscera, and also most particularly of the omentum, which was caused by plethora of the blood. The inflammation resulted in suppuration, which could increase in putrescence and then become infection. Amusingly, he said that studying the statistic of admission and mortality of puerperal fever between 1768 and 1771, it demonstrated numerically that the cause could only be the malignant constitution of the air. What could be the malignant constitution of the air? Well, miasma. And in fact, in 1752, John Pringle, in his book on the observation of the disease of the army, wrote, I conceive that the miasma, or septic ferment, consisting of the effluvia from putrid substances, being received into the blood, may have a power of corrupting the whole mass. The concept of miasma was also defended by Nathaniel Hume in London, saying particularly that the putrid miasma were only present in a hospital and they were caused by airborne contagion. The putrid effluvia exhaling from wounded men brought on a fever which killed a great many childbirth women may lay in the same hospital. In Paris, Daniel de la Roche, who was a doctor of the Swiss Guards, published his book, on puerperal fever. And one chapter was devoted to the influence of bad air on women, le mauvais air, on women in childbirth. And I like just to take this opportunity to say that it was just the title of my last book, in which you can also find different aspects of the story I'm telling you. So, to illustrate that idea, Paul Dubois, who was the dean of the Faculty of Medicine and working at the Hôtel Dieu, explained that on the lower floor were admitted the wounded patients, and they were dying due to hospital fevers. And from them, there were miasma going up to the upper floor, where pregnant women were admitted, and those were dying due to puerperal fever. And he said, it's well known that miasma are only going up. And before that time, when the pregnant women were in the lower floor, below the wounded people, there was no puerperal fever. So miasma are only going up. So Stéphane Tarnier was head of clinic in the Paul Dubois department. And he acknowledged that puerperal fever was contagious, even though he admitted that very few people in France believed in it. But he promoted the concept of contagious miasma, and he refused to admit that doctors could transmit the disease, saying their evidence is insufficient. But he did a quite interesting demonstration showing the existence of a putrid poison, taking the peritoneal fluid from a woman who died of puerperal fever, injecting in animals, and showing that 2 out of the 4 animals died of sepsis. By the end of his career, Stéphane Tarnier, where you can find this statue at the cross between the Avenue de l'Observatoire and the Rue d'Assas in Paris, Stéphane Tarnier, in his book on asepsy and antisepsy, claimed that there were 3 periods. The first one in 1858 to 1869 was a period of inaction, and the mortality was 9.3%. From 1870 to 1880, it was the fight against contagion, and the mortality decreased to 2.3%. And finally, From 1881 to 1889, there was the antisepsis period, and the mortality was roughly 1.1%. Now we have to address the link between bacteria and infectious disease. Let's quote Jean Rostand. It is commonly believed among the public that it was Pasteur who discovered the role of microbes in the production of infectious disease. In truth, this considerable discovery does not belong to him. It belongs to another French scientist, Davenne, who was the first to dare to affirm and was able to demonstrate by the experimental method that a microscopic organism is the agent responsible for a disease. And similarly, Jean Theodorides, in his beautiful book From Miasma to Viruses, was an historian of science, said it was the little-known French scientist Casimir Davenne who first demonstrated the pathogenic role of bacteria in humans and domestic animals. So that demonstration occurred in 1863. So he described thread-like bodies, which were the bacteria, in the blood of sheep infected with anthrax, and demonstrated that the disease was transferable through the blood to other animals. Interestingly, it transmitted to rodents. Nothing happened, and I think this is interesting for those who are interested in animal models. But finally, it transferred the blood to the blood and observed that the bugs he could see in the blood of the sheep were also seen in the blood of the rabbits, and that the bacteria could also be transmitted from rabbit to rabbits. He said, for a long time, doctors and naturalists have theoretically admitted that contagious disease, serious epidemic fever, the plague, etc., are caused by invisible animalcules or by ferments. But as far as I know, no positive observation has ever confirmed these views. And in 1873, it demonstrated that only a live bacteria can transmit the disease. Back to Vienna in 1865 and back to Karl Mayhofer. You remember the one who was asked by Braun to demonstrate that Semmelweis was wrong. In 1865, in his last paper, he took vibrions they observed under the microscope from uterine tissues and injected the rabbits and showed that those vibrants were killing the rabbits. So he was probably the first one to make the link between vibrions from dead women as a source of death. Mayhofer concluded that puerperal fever was a fermentation disease in which tissue decomposed under the influence of the living vibrions. Now we are back in France, in Strasbourg, with the work of Victor Fels and Léon Cauze. In 1866, so 1 year after Karl Mayhofer demonstration, they were studying the presence of infusoria in the blood of various infectious disease. And in patients with typhoid fever, with smallpox, with pneumonia, with erysipelas, with scarlet fevers, they could show that taking the blood of those patients and injecting in rabbits, they were inducing fevers and finally death. And that death could be transmitted from rabbits to rabbits to rabbits to rabbits. So they concluded that infected human blood induced death. And finally, in 1869, they published in the Gazette Médicale de Strasbourg that deadly bacteria exist in the blood of sepsis patients. So they took the blood of a woman who died of puerperal fever, observed the microbes, and injected them in rabbits, and observed that most of the rabbits died with clinical symptoms similar to the women who were dying of puerperal sepsis, and that, once again, it was contagious from rabbit to rabbit, transmitted from rabbit to rabbit. Amusingly, in this paper, they report an observation that missed a discovery. They were medical doctors, so they transmit the blood to Charles-Louis Engel. He was a professor of botany, used to look under the microscope and to see the bugs. And they noted that there was a contamination of 2 broken tubes, and that contamination was by penicillium spores. And in this tube, there was no bacterial growth. We were 60 years before the discovery of penicillin by Alexander Fleming. So finally, they published in 1872 this book on the infectious disease and the presence of ferment. There are different chapters on septicemia, puerperal fever. They said the rabbit is one of the organisms that, from an experimental point of view, lends itself best to the development of infusoria. Again, a statement of interest for those interested in animal model. The corpse of an individual who died of septicemia usually shows no significant damage to the organs. Examination of the blood alone revealed the nature of the disease through the presence of infusoria. Chains of bacteria entirely similar to those found in septicemia are found in the blood of women with puerperal septicemia. In 1879, on March 17th, they published in the Compte Rendu de l'Académie des Sciences a new observation. It was nowadays in Nancy because France has lost Alsace after the war in 1870 against Prussia. And a reported new observation of new bacteria he called Leptothrix puerperalis, and again made the observation that these bacteria injected in guinea pigs were inducing death. The following day, on March 18th, 1879, Pasteur confirmed the work of Fels and Cause published 10 years earlier. And with Edouard Hervieux at the Port Royal Maternity Hospital, they published that the cases of 2 women who died of sepsis, of puerperal fever, and showing that bacteria were observed in lochia, blood, fused from the uterus. And they suggested the use of boric acid to wash the genital tracts. So Pasteur came in touch with Victor Fels and said, my poor guy, you are wrong. Those new bacteria you observe are just Bacillus anthracis. And I will demonstrate that your patient who died of puerperal fever, in fact, died of anthrax. So he asked the blood of the patient, of Dr. Fels, injected in guinea pigs, as well as he injected the blood of animals with anthrax in 2 other guinea pigs, either from Chartres or from Jura, and sent those guinea pigs infected with anthrax by train from Paris to Nancy. And the poor Dr. Fels just recovered, welcomed these dying guinea pigs, and could not say anything else than, of course, I'm very sorry, and published that he was very sorry not to be aware of anthrax and of his error. So you all know this famous painting of Louis Pasteur having in hands a vial of dry spinal cord. But now just think about nowadays. Pasteur will be on all social media using TikTok, and I'm pretty sure that he will be using those social media to advertise all his observations. Now, to finish the story of puerperal fever, I'd like to mention the discovery by Gerard Domac in 1935, who discovered the sulfamidochrysoinine, which were patented under the name of Protosil, the first commercially exploitable antibacterial drug. And for that work on antibiotics, he got the Nobel Prize in 1939. And the following years, Leonard Colebrook in London used that Protosil to treat mice in an experimental infection and human with puerperal infection, and showed the decrease in mortality. So the success of this antibiotic. And finally, in 1935, Jacques Trefuel and Thérèse Trefuel isolated the sulfamides from the Protosil. Now it's time to identify the source of this infection and the toxin, and to talk about the bacterial poisons. The first one to talk about that was Nikolai Fedorovich Gamaleya. He was a physician, and he was a physician as well, from Odessa. And he showed in 1888 that dead bacteria were pyrogenic, and that they could, injected in rabbits or sheep, could cause fever. And quite amazingly, he made the following demonstration that alcoholic extracts of favorite sheep's spleen induce fever in rabbits within 30 minutes. And finally, in 1892, he published this book on les poisons bactériens, the bacterial poisons. He was supposed to join the Institut Pasteur and was very much in contact with Louis Pasteur, but finally never joined the Institute. The other demonstration was achieved in 1889 by Sir Marc-Armand Ruffert and Albert Charon at the Faculty of Medicine in Paris, and they showed that the supernatants of bacterial culture were also parogenic. And they said that filter culture of Pseudomonas aeruginosa can cause fever in rabbits in the absence of live or dead bacteria. The most fascinating is that the author wrote, but did not prove, that fever was the consequence of macrophage activation. This was well before the discovery of endogenous pathogen, alias IL-1. So what they were dealing with in their supernatants, of course, you guess it was endotoxin. The word was coined in 1892 by Richard Pfeiffer, a physician and a bacteriologist. But he was believing that the toxic effects of the bacteria were due to an internal factor released by the live bacteria. Mentioning another Ukrainian researcher, Alexandre Besreka, working at the Institut Pasteur with Mechnikov, in 1906, he was the very first one to obtain anti-endotoxin antibodies. For that, he injected a typhoid vaccine in horses, got the immune sera that he injected in guinea pigs, to which he injected 30 lethal doses of typhoid endotoxin and showed their protection. Finally, the first to demonstrate the biochemical nature of endotoxin was where Lydia Mesrobeanu, during her thesis in Bucharest, and André Boivin, who later on will join the Institut Pasteur. So they call about the antigen glucidolipidic of bacteria, which nowadays is well known as lipopolysaccharide. And finally, as I said, André Boivin joined the Institut Pasteur in Garches. So now, what is the legacy of Semmelweis and Pasteur? Well, of course, it's particularly surgical asepsis. And Joseph Lister, of course, in 1865, learned about Louis Pasteur's theory that microorganisms cause infection. Using carbolic acid spray, we see here or here, as an antiseptic, he reduced the mortality rate of amputees patients to 15% in 4 years, compared to 45 to 50% previously who were dying of septicemia. And he did the same for other types of surgery, and also had very good results in the reduction of fractures. For example, he operated one patient who had consulted 18 surgeons before having surgery by Lister successfully, but the other 18 surgeons didn't dare to make that operation because worrying about infection. Amusingly, Lister was also a microbiologist and published this book on natural history of bacteria about the germ theory. And he discovered the bacterium lactis, which is nowadays known as the Lactococcus lactis, which is present in the milk. In 1879, Dr. Joseph Lawrence and pharmacist Jordan Whit-Lumber created Listerine to pay tribute to Lister as a surgical antiseptic, which was later on marketed in 1914 as a mouthwash in the United States and nowadays all over the world. And as you know, the bacterium Listeria was also named in his honor. I'd like to present this painting on the Jubilee of Louis Pasteur in 1892 for his 72th anniversary. And in fact, the person who is in the middle of the table of the painting is not Pasteur, is Lister. So I think this is an interesting fact that is play a key role. Amusingly, of course, some doctors, especially in France, like Jules Lemaire or Gilbert Declat, claimed that they were using carbolic acid before Lister, but clearly they didn't invented the spray. It's true that they use carbolic acid in surgery for treating the wounds, but not for the atmosphere. So the surgical asepsis, as described by Lister, was reintroduced in France by just Lucas Chambonnier. And in the States, the key role was played by Lewis Atterbury Stimson. In his letter written to his brother, he said, "My dear Henry, the other day I went to the Academy of Medicine, had the chance to see and listen to Pasteur on spontaneous generation. Calcium hyposulfite instantly destroyed all germs." And finally, in 1876, he successfully performed the first operation in the States, an amputation under the complete aseptic condition. Following his germ theory, Pasteur said, "If I have the honor of being a surgeon, aware as I am of the dangers posed by germs spread across the surface of all objects, particularly in a hospital, not only would I use instruments that were perfectly clean, but after washing my hands with the utmost care and subjecting them to rapid flaming, I will use only gauze, bandages, and sponges that have been previously exposed to air heated to a temperature of 130 to 150 degrees, and I would only ever use water that had been heated to a temperature of 110 and 120 degrees. In this way, I would only have to fear the germ suspended in the air around the patient." That's exactly what Lister did. And as you probably know, Louis Pasteur in his laboratory was always asking his collaborator to help him to clean his and washing his hands, and Pasteur was hating hand shaking. So clearly, one of the testimony of legacy of Semmelweis is hand washing. And we know that during the COVID-19 period and in all hospital and all around the world, hand washing was very much important. And we have to also thank Didier Pité in Switzerland, who invented the hydroalcoholic gel. So this is coming to the end of my presentation. I'd like to mention that most of what I've said can be found in this paper published a few years ago, From Septicemia to Sepsis-Free, from Ignaz Semmelweis to Louis Pasteur. But I'd like to come back to the present and mention this work, this paper that we have published last summer with Jean Carlet. Jean Carlet was the very first physician who trusted me and who helped me to initiate our translational research. And with him, we have written this new review challenging the definition of dysregulated host response and saying that it's rather a yin-yang effect between beneficial effect of the innate immunity with the same players playing a deleterious during inflammation. And with that, I'd like to thank you for your attention.
Thank you so much, Jean-Marc, for this fantastic lecture. There are a couple of questions in the chat, so we'll just pick one or two of them. First, Oliver Jones is asking about, or is willing to know whether Semmelweis was indeed sanctioned during his life because of his theories about the way the woman got infections.
Well, the problem of Semmelweis was his behavior. And I think, as you've seen already, when he's got married, the family in law were calling him the crazy Ignaz. So probably his behavior was not fully cool, and it was rather aggressive. And we have seen the way the French doctor, when they received the book, considered that it was too aggressive. So I think, unfortunately for him, his behavior was a bit deleterious for propagating the good words.
There's another question from Jesus Villar, who is more a comment than a question, but I'd like you comment too, suggesting that infections through sepsis were likely the most common cause of death during war in the past. Would you agree?
Yeah, I mentioned that. I mean, clearly sepsis was very common. I mean, you have seen these mummies of young children at the Egyptian time who died of sepsis. So I think since the beginning, sepsis was rather common. And obviously, I consider Florence Nightingale did a great job in her hospital to introduce the hygiene. And clearly, as we have seen with Richard I of England, most of the wounded person, if they were not dying of their wound because they were not lethal, finally in the hospital, they were dying of sepsis. Yeah.
Also, Jérôme Fleurier is asking whether, because you nicely showed how hygiene, but also the discovery of treatments like antibiotics have been important in the fight against sepsis. But he's asking, to your opinion, which one was the most important, hygiene or the interventions like antibiotics and immune therapy?
I don't think I will rank them. I mean, it's a set of major statement and discoveries. And of course, well, during 19th till the 19th century, I mean, antibiotics were not used. So hygiene during that all that time was clearly the most important. And nowadays we are well aware that antibiotics are the key role because I mean, the surgeons and most of the people don't ask themselves about hygiene. And once you have an infection, use antibiotics. So I will say from the 20th century, antibiotics may play a key role until the 19th century, hygiene was playing the key role.
Also, Andrea Pujar is wondering what is lochia, what lochia means.
Well, I think it's in the uterus during the pregnancy and surrounding the baby, if I'm correct.
Okay, yeah. And so before leaving, I might have a final question for you. You nicely demonstrated that the story of sepsis very likely begin with puerperal fever and causing high mortality, high maternal mortality. And still, we can see today that sepsis is still remains a very frequent cause of maternal mortality. So we were expecting that hygiene now is better than in the past. So why women still continue to pay a huge tribute in terms of mortality during during maternity, indeed?
Yeah. Well, all around the world, the main source of mortality nowadays for women is hemorrhage. But you are right that still far too many women are still nowadays dying of puerperal fever, mainly in the developing country. And I think we should clearly continue to fight to favor the hygiene and especially the awareness of the people about sepsis. I mean, this is what you have done and what you are doing. I think clearly awareness of sepsis all around the world, not only in the medical community, but among the public will be important to realize that infection remains a danger, wherever you are.
So maybe the final question, the ultimate one, is from Marcin Osuszowski, who is asking you, what do you think about bacteriophages owing to microbial resistance becoming public health threats. So would bacteriophages being the avenir, the future?
I think they will be part of it. Clearly, I mean, I don't know for sepsis, but for some infection, I know that some staphylococcal infection which are antibiotic resistant, and especially on the bones, for example, and especially in Tbilisi, they have a special institute entirely devoted to the use of bacteriophages, and people are sometimes traveling to Tbilisi in Georgia to be treated. There is a major difficulty is a kind of standardization of the bacteriophages. So it's a difficult in terms of having a FDA approval, and that is the limitation. But yes, I think, and there are quite a few examples of success with bacteriophages, and we can hope that in the future, and I know that in many countries, there are different groups working for the use of bacteriophages.
Thanks again, Jean-Marc. There are other questions, but we are coming to the end of this web conference. And so just before leaving you, maybe I would like to remind you, and Gael, you can show the slide. The next conferences for October, it will be done by Manu Shankar-Hari from the UK about vaccinating for better outcome. Tom van der Poel will talk about sepsis phenotypes in November. Julian Knight from Oxford will talk about the challenges and opportunities of genomics in sepsis. Caroline Calvi will talk about the journey towards individual treatments in sepsis in January, and Margaret Herridge will talk about the post-sepsis syndrome in February. Once again, I would like Jean-Marc to thank you very much and all the attendees around the world, and I hope to see you next month.